To ask the pet doctor if you got a question for Dr. Jerome Williams. I'm going to call now, 741-9272. Good to see you this morning.
Good morning. Good to be here.
Yeah, Jillian, you excited about Thanksgiving?
Oh, yeah. Maybe something will drop on the floor.
Well, I was going to ask you about that because, at this time, if you've got a dog especially, they can smell the turkey. They can smell all the food. And people are tempted, as maybe kids.
Right.
Hey, let me just give the dog some of this. So what types of foods should they or should not give the dog?
Very minimal amount. Very minimal. We see so many cases of pancreatitis and or bone impactions this time of year. So keep the table foods to a very, very minimum to your pets.
Okay, because they may want them, they're just not good for them.
Right.
And this time of year, too, you're talking about a lot of holiday foods, things where dogs can get into, and I'm sure you see a lot of calls out in your office where the dogs eat something they shouldn't be eating, or cats as well.
Exactly, and we see those GI upset problems, and just one of those things you got to be aware of. That, the dog's going to come and look and beg and look pitiful, and you say, well, I think he should have a little bit more. Don't do it. Please don't do it. Raisins, one of those things that's part of our cooking menus often. Dogs should not have them.
Oh, okay. Yeah, because the dogs, they don't know any different. They just smell food. They think, oh, I want this. This is good for me.
Right.
But also now the plants too, poinsettias. We know those.
Poinsettias, yeah.
If they eat those, should they bring them in? Is that something you just kind of let run its course?
Give a call. Give a call to us, or we're closed, emergency clinics, and they'll advise you on what to do depending on the plant and how long it's been eaten.
Okay.
That'd be the best thing to do.
All right, we have our first call calling in from Arley, and I believe it is Jane.
Yes.
James, how you doing?
I'm doing pretty good today.
Hi, James.
And what's your question for Dr. Jerome?
I got a little Pomeranian, and she coughs and chokes and spits up. Sometimes she vomits.
James, how old is she?
She's about 10 years old.
Okay, it's something that I think you really need to see a veterinarian about. When you get in that age, there are so many things that could be causing it. One of those I'm concerned about is heart disease. So make certain you get her in and get her seen so she can be evaluated and treated appropriately.
Okay.
All right, appreciate the call.
Thanks, James.
Thank you so much, James.
All right, thank you.
All right, again, 741-9272 to ask the pet doctor. And traveling with pets. We know dogs like to travel. Any considerations people would think if they're taking on a long trip?
Yes, if they're not used to riding, they may get motion sickness. And you can use some of the same medication that you use for people. A dog this size uses a half of the Dramamine type thing, and a larger dog, you can use the full size. Okay.
All right, next on the line we have Brenda calling in. Brenda, good morning.
Good morning.
And happy Thanksgiving. What's your question?
Thank you. I have a Jack Russell female. It's about 9 or 10 years old. And periodically she just coughs and coughs for no apparent reason. And it's usually after she has drank cold water. Or it used to be that way, and now she just does it periodically for no reason.
It may be taking Arian if it's after eating or drinking. It could be taking Arian, creating that problem. Like the previous caller, get it checked out. At that age, you begin to see aging changes like heart disease and whatnot. And it could be allergies. Jill would do it with being in an environment where she's allergic to something. If nobody in the house is a smoker, then get her checked out and see if any of those things may be factors.
Okay, now she does have skin allergies, so
Yes.
it could be.
Yes.
Okay.
That may be the cause. Now, you can give Benadryl at the dose of 1 milligram per pound 3 or 4 times a day and see if that makes a difference for you.
All right.
Okay, well, thank you.
Hope that helps. Thank you so much for the call. And we have another Brenda on the line. Brenda's calling in from Jasper. Brenda, how are you?
Fine. How are y'all doing?
Doing great.
Thank you.
What's your question for Dr. Jerome?
I have a Shih Tzu, and I had her fixed back in April, and she's like 6 years old, and it's something like psoriasis on a human, but she turns like really red and swells up. I'm talking about all over her face, around her eyes, her neck will swell. And when the swelling goes down a couple of days, it has a bad odor to it, and they told me to give her Benadryl for the swelling, but she's allergic to fleas. She doesn't have any fleas.
Okay. She's allergic to something. If it swells like that, you think it may be something even eaten or taken in.
They told me to take her and put her on grain-free food. So I've done that all year, and it
still happens.
Yes, sir.
Not only grain-free food, but you also need to go to one meat source. something that she's not used to, like lamb or venison, even duck. But stay with one meat source at least a month and make certain that nothing else, no treats, nothing else but vegetables and fruits. You can give carrots, apples, things like that, and make certain that it's not a food source that's causing it. Grain-free alone is not sufficient.
Okay. Because they tell me to give her Benadryl, and I hate giving that to her every night.
Yeah. You should be able to get to the bottom of it.
Okay. Brenda,
Okay,
thanks for
so-
the call. I hope that helps. Thank you so much, and happy
Thank you.
Thanksgiving
You'll have-
once again.
Thank
Absolutely.
you. Y'all have a great Thanksgiving.
You too. Dr. Jerome, appreciate it.
All right.
Enjoy
get it
your
done.
Thanksgiving.
You do as well.
You too, Jillian. Bye-bye. All right.